If your patient is not breathing or has noisy or gasping breaths, perform the jaw thrust maneuver. Place your thumbs on the patient's cheekbones and then take your index fingers and put them behind the jaw. Push the jaw forward and hold this position to keep the patient's airway open. By performing this maneuver, you will lift the tongue off the back of the throat and keep the airway open. For some patients, this is all that's necessary to keep them breathing properly. If a patient is vomiting, or while you're waiting for transportation to arrive, you should place them in the recovery position. Kneel at the patient's side and take the arm that's closer to you. Bring this out to 90 degrees. Then take the arm that's further away and gently bring it across the chest. Place your palm on the patient's palm, but don't lock the fingers. Then place the back of the hand against his cheek and hold it in place. Next, lift the leg that's further away up to 90 degrees and gently roll the patient onto his side. Remove your hands and make sure that the upper leg is bent to 90 degrees so that the patient does not roll onto his stomach. The recovery position keeps the patient's airway open and allows fluids like blood or vomit to drain from the mouth. It also helps to keep the neck straight to protect the patient's spinal cord. If your patient has bleeding from an injury, apply firm, direct pressure on the wound. First, protect your hands from blood by using gloves, and if you don't have gloves, you can use a plastic bag or plastic wrap. Do not remove anything embedded in the wound because this can cause more bleeding. Find a clean bandage, towel, or cloth and place it directly over the wound. Then use the heel of your hand to apply firm, direct pressure. Do not use a lot of force if the wound is on the face, chest, or abdomen. Use only enough pressure to stop the bleeding. If blood soaks through the first layer of cloth, do not remove it. Place another layer of cloth on top of it and continue holding pressure. Hold pressure on the wound for at least 15 minutes or until bleeding stops completely. However, if you are alone, you may tie the bandage firmly into place. Applying firm direct pressure on a wound will allow the body to form a blood clot. It's important that you hold pressure long enough for the body to form a clot, and once the blood clot forms, it will help to prevent further bleeding. If a patient has a partial or complete amputation of an arm or a leg, apply a tourniquet to stop the bleeding. Find a rope, torn strips of cloth, or something similar to tie around the limb. First, tie this around the limb above the site of the injury, closer to the body, and tie a double knot. Then find a stick or something similar and tie this in with a second double knot. Twist the stick until bleeding stops completely, and then use a second strip of cloth to tie this into place to keep it from unwinding. This second strip does not need to be as tight as the first used to stop the bleeding. Once a tourniquet is applied, no one except a doctor should remove it. A tourniquet will stop the flow of blood to a severely injured limb and prevent the patient from bleeding to death. If a patient has a broken arm or leg, you should apply a splint to stabilize the bones. However, you should never delay the transportation of a severely injured patient to apply a splint. Find a stick or something similar to stabilize the bones. The splint should be long enough to stabilize the joint above and below the site of the injury. Do not try to straighten injured limbs before splinting them. Tie the splint into place. And make sure that you can slide a finger under each of your knots. If your patient complains of increased pain or numbness after you have placed a splint, remove the splint and start over. A splint helps to keep broken bones stable, to reduce pain and prevent further injuries. When you're removing an injured patient, hold the head to make sure that the neck does not move. You can either use your hands or a rolled piece of cloth. Kneel so that you are positioned above the patient's head. Then place your hands over the collarbones with your thumbs on top and your other fingers underneath. Place your forearms over the patient's ears. And then use your arms to keep the head from moving. Fashion a collar by rolling up a towel, sheet, or an article of clothing. Make sure that the roll is thick enough to keep the neck from moving. Slide the rolled cloth under the neck without letting the head move. Once the roll is under the neck, cross it over the chest and tuck the ends into the armpits. Be sure that you don't wrap anything too tightly around the neck so that breathing is not affected. Keeping the neck from moving in badly injured patients helps to prevent damage to the spinal cord, which can cause paralysis or even death. When you are moving an injured patient, use the log roll technique to place him on whatever you will use to transport him. One volunteer holds the neck stable using their hands. The other volunteer kneels at the patient's side and puts one hand on his shoulder and the other on the further hip. The person holding the neck stable gives the order to roll the patient and gives a count to 3. At the count of 3, the volunteer kneeling at the patient's side gently rolls the patient towards him onto his side. The person holding the neck turns with the patient in order to keep the neck stable. Once the patient is on his side, a third volunteer will slide whatever is being used for transport up to the patient's back. 1, 2, 3. The person holding the neck again gives the order to roll the patient back and gives a count to 3. On 3, the volunteer kneeling at the patient's side gently rolls the patient onto his back again. And let's get everybody on a corner, and we'll go ahead and lift on my count. 1, 2, 3, and lift. The log roll technique keeps the patient's neck and back straight to prevent damage to the spinal cord, which can cause paralysis or even death. If you don't have a stretcher or a piece of wood available, you can use a tarp or a sheet to carry your patient. And then we're going to roll it down halfway. Using the log roll technique, turn the patient on his side. When he's on his side, take the rolled end of the sheet and slide it up against his back. Then using the log roll again, put him on his back and roll him to the other side. 1, 2, 3, and roll. When he's on his side, unroll the sheet and then return him to his back. When you are carrying a patient or lifting him into a vehicle, one volunteer should continue holding the neck stable. That volunteer gives all directions to lift and move the patient. 1, 2, 3, lift. Once the patient is in the vehicle, place them in the recovery position if you have enough room to do so. And then we'll roll him onto his back, and then you'll roll him onto this side, and then what you'll do... Having only one person giving directions to move an injured patient is extremely important. It helps to prevent uncoordinated movements, which can cause further injuries, including paralysis or even death.